Welcome to Local Discovery, a spotlight on health. It's the show that travels the country to find answers to how we can all live more healthy, active, stress-free lives. I'm Kristen Martin, and today I've returned to sunny Tallahassee, Florida to meet with the professional team of Tallahassee Memorial Healthcare. For the next half hour, I'll be quizzing the doctors, polling the nurses, and speaking with the patients to get the answers that you're looking for. From radiosurgery and neonatal services to addiction treatment, diabetes management, and how state-of-the-art technology is helping to improve cancer treatment, plus so much more. If it will shine a spotlight on your healthcare concerns, you'll find it right here on Local Discovery, a spotlight on health. Today we're going to begin our visit right here at the newly opened Outpatient Cancer Center at One Healing Place. Focused on an atmosphere of hope and healing, this new center has a host of programs and services, an incredible team of professionals, and state-of-the-art technology that is advancing cancer treatment.
Well, our new cancer center opened in January of 2011, and it was designed to promote an environment of healing for our patients. We've had a long-standing affiliation with Moffitt Cancer Center between them and ourselves at TMH Cancer Center, and this allows us to provide clinical trials and other protocols that may not have been routinely available in the community.
Dr. Newman, I have to say that this beautiful new facility here, the Outpatient Cancer Center, is really quite impressive. Were you able to introduce some new services because of this facility?
We have, and once again, everything that we've done is with the patient's healing and promoting a healing environment in mind. Now we have new equipment that allows us to deliver more treatment more rapidly or more quickly during their therapy. We have the patient navigators, which are available to assist patients while they're undergoing treatment. We have a survivorship program that allows them to assist with the transition from undergoing treatment every day to returning back to their normal daily life. We also have a pet therapy program. We have board-certified physicians that have over 50 years of experience in radiation oncology and just a wonderful staff.
Now, you did mention technology, and this piece of equipment behind us is, well, I don't even know what to call it. Tell me a little bit about the new technologies that you're able to use here at the Outpatient Center.
Well, but prior to this, we did have the standard complement of radiation therapies available. We had the external beam radiation, we had internal radiation with brachytherapy, which is used primarily for GYN implants or prostate seed implants, as well as stereotactic radiosurgery and some IMRT. Now with the new equipment, we're able to do much more accurate intensity modulated radiation, or IMRT, image-guided radiation therapy, and now with the Novalis, more stereotactic radiosurgery and stereotactic body radiation therapy.
Radiosurgery, or really stereotactic radiosurgery, is the use of focused radiation to treat some sort of a lesion or condition in the brain. It's typically an outpatient procedure for which the patients come in, lie on a table, have a short treatment of radiation, and then they go home. Radiosurgery is not surgery in that there is no cutting involved, there's no bleeding involved. It's strictly a procedure which is done by radiation through the skin, but there is no actual surgery being done. We can treat a lot of conditions with radiosurgery. The most commonly treated condition is cancer. We treat metastatic lesions to the brain, we treat primary tumors of the brain, and so the majority of what we do is the treatment of cancer. For patients, this is very convenient. What they really do is the patient now has all of the pre-treatment work done before they even arrive. They come in, basically they lie on a table, and the machine performs the radiation treatment, and then 30 minutes to an hour to maybe 2 hours later, if it's a very complex treatment, they get off the table and they go home. No incision, no scar, and no pain.
So are you finding that with the addition of all this new technology that the care for your patients is improved and you're seeing better response?
Oh, absolutely. We're finding that our patients' treatment times have been decreased and Potentially with an IMRT previously, it could take 25 minutes, and this is given every day, 5 days a week for 6 to 7 weeks of treatment. Now with the new equipment, we can deliver the treatment in often 5 to 10 minutes, which definitely improves patient comfort and ease during their treatment. With the image guided and the IMRT, we're finding fewer side effects and more accurate targeting and potentially fewer complications. And then with the new Novalis and the radiosurgical equipment, we're able to offer therapies that simply weren't available in this region before. So we're very pleased and very happy to be able to offer these services for this community.
Medical advances are being made every day in the treatment of breast cancer. And now, thanks to the Breast Prosthesis Boutique located at A Woman's Place, breast cancer survivors and other patients of breast surgery can feel more confident and secure in their appearance than ever before. The Breast Prosthesis Boutique offers a private shopping experience with personalized service for women who have had a mastectomy or other breast surgery. The Breast Prosthesis Boutique carries a full line of breast forms, mastectomy bras, camisoles, and skincare products. And with a certified prosthetics fitter available to assist you with all your needs, you'll be sure to find the right solution the first time. From skincare lotions that are specially formulated for intensely dry skin that can result from cancer therapy, to undergarments that will help you to look great in your clothes, the Breast Prosthesis Boutique is helping breast cancer survivors look good and feel even better. For some cancer patients, the swelling of the arms or chest area can be an issue. This condition is called lymphedema, and it requires ongoing management and therapy. At Tallahassee Memorial Healthcare, you'll find specialized treatment with the only certified lymphedema therapist in the Big Bend region.
Lymphedema is caused by issues in the lymphatic system such as surgeries, trauma, or venous insufficiencies. Lymphedema can be treated by manual therapy with a physical therapist, and then you maintain it by wearing compression garments that will keep the swelling down in the arm. Other areas where we fit people with compression garments are lower extremity. We do knee highs, thigh highs, and full pantyhose as well. Lymphedema can be a lifelong condition, so you will want to wear your garments daily. Most people do not need to wear them in the evening while they're laying down in bed because there's no swelling at that time, but especially if you're going to be active doing gardening, exercise, or definitely flying, you'll want to wear your compression garments. Patients that have had a heart attack, stroke, diabetes, pregnancy-related swelling, or even wound care can benefit from compression garment therapy.
If you suffer from gastroesophageal reflux disease, more commonly known as acid reflux, well, you'll be very happy to hear that there is now a new procedure that's incisionless. It's relatively painless, it's very fast, and it's had incredible success. Dr. Crooms will explain more.
We have found a new procedure for gastroesophageal reflux disease. Gastroesophageal reflux is where the acid in our stomach comes up into our esophagus and maybe even up into our throat. All of us have that. There are patients that certainly are more symptomatic than the average person. And those patients end up being put on medication, and they're on medication for their entire life. We have always had surgical options for those patients, but those procedures have been done with either a large open incision, or in the past several years we've been able to do those procedures laparoscopically, which is a major benefit to the patient in regards to less pain and a faster recovery. What has also been developed over the last few years has been an incisionless fundoplication. That is where we actually go down your mouth with a lighted endoscope looking in your stomach and then perform a fundoplication, which is a partial wrap of that area where the esophagus enters the stomach. In a laparoscopic or open procedure, we'll do a full 360-degree wrap in most cases, although in some we also still do a partial wrap. But endoscopically we are a little limited, and therefore we're only doing a 270-degree wrap. What our studies have shown us so far is that patients, 80% of patients receive some benefit from this, either getting off of their medication entirely or being able to cut those down. It is done often as an outpatient. Many times those patients will spend one night in the hospital and then be discharged the following day and return to work within 2 to 3 days. We do ask patients to stay on a liquid to soft diet for 2 to 4 weeks, but eventually they're able to eat a standard regular diet, and hopefully will be off of all of those medications. We're the first ones to bring this to North Florida. and look forward to providing this service to our patients.
Did you know that an estimated 22 million Americans suffer from substance abuse or dependence? Well, luckily for Big Bend residents, Tallahassee Memorial has both the outpatient and the inpatient recovery centers. They're two very safe places where you can beat addiction and the emotional strains that accompany recovery.
At the Recovery Center, we provide both inpatient as well as outpatient recovery services, focusing in on detox in the acute phase as well as outpatient groups in our intensive outpatient substance abuse treatment program. Here at the Recovery Center, we view addiction as a complex medical illness. We focus in on treating not only the patient but the patient's family in their recovery process. Our recovery team is consisting of not only psychiatrists but therapists, social workers, and other members of the community, including AA and NA. Suboxone is a treatment that can be used in an inpatient setting for detoxification. It can also be used in an outpatient setting for maintenance treatment for opiate addiction. Here at the new Outpatient Recovery Center, we do offer outpatient individual as well as group therapy. Our intensive outpatient substance abuse treatment program is also housed here at the Outpatient Recovery Center. We also offer dialectical behavioral therapy, which is a specific form of therapy focused in on trauma for patients that are suffering from addiction as well as patients suffering from mental illness. Our team of psychiatrists, therapists, and social workers are well versed in treating both mental health issues as well as substance abuse issues. We do view that they do run hand in hand and often have to be treated independently. One of the things that is most rewarding about working at the Recovery Center is seeing people on a daily basis make changes in their lives, both within their families as well as integrating themselves into society. We see this here at the Recovery Center on a daily basis, and it's very encouraging to come to work and see people do as well as they've been doing.
You can beat addiction with the professional help available right here at the Recovery Center. We always anticipate the healthy birth of a child. However, complications can occur, and it's during these times that you want the most up-to-date technology and the very best neonatal team available, and you want them at a moment's notice. Jessica, why are technology and speed so important when we're talking about neonatal services?
Well, we have seen that technology has significantly reduced the mortality rate in this special population over the past 20 to 30 years. And when you're dealing with a patient population ranging from less than a pound to 10 pounds, technology and speed are critical.
And what types of complications are you able to treat right here in this facility?
We're able to treat complications of preterm delivery, unforeseen complications during delivery, sepsis, minor surgeries, congenital malformations. We have everyone from nurses, respiratory therapists, nurse practitioners, doctors, and subspecialists that we consult, such as pediatric cardiologists, neurologists, ophthalmologists, and general surgery as well.
We've been treated very good. The nurses here have been very friendly. They've helped us, they've asked us if everything's fine, explained every procedure. Been real encouragement to us, letting us know that other parents have been through this before and that everything's worked out good for them, and it's really been an encouragement being here every day.
What types of services can the parents and the babies expect to find here at the neonatal ICU?
We have a Ronald McDonald house where they can stay if they're from far away. We have a Ronald McDonald room where they can be in the hospital but not in the unit. And we have a music therapy program where music therapy works with the babies that are learning to feed and are growing. We have social services available, and we have a bereavement program available to parents who have had a loss or are expecting a loss.
Now, this is the only neonatal ICU in this area. Do you think that sets you apart?
Absolutely, it does. As a matter of fact, we are the only neonatal ICU in the area in this region, and there are multiple surrounding counties that we transport in from.
Do you feel like very fulfilled at the end of each day?
Absolutely, I do, and it's especially great when parents bring their babies in that have gone home. We had one come in last Friday who had been here for a while and was special to all of us, and it was great just to see her healthy and growing and no wires attached. So
that's a great story.
Yeah.
Thank you so much, Jessica, for talking
You're
with
welcome.
me today. For the best in professional neonatal care, don't forget about the neonatal ICU unit right here at Tallahassee Memorial.